All right, future medical coders, welcome. In our world, getting the details right is everything. Today, we're zeroing in on two super important CPT codes, 76641 and 76642. Nailing these breast ultrasound codes is a must, so let's just dive right in. So this is the big question for today, isn't it? It sounds simple, but telling the difference between a complete and a limited exam is the absolute key to coding these correctly. And trust me, by the end of this, you are going to know this difference inside and out. Okay, first up, let's tackle the complete exam. This is the whole shebang, the really comprehensive procedure, and it gets CPT code 176641. So, what exactly makes it complete? Now, the official CPT definition for 76641 is pretty straightforward, right? It's for a complete ultrasound of one breast. But for us as coders, the real question is, what does complete actually mean? What are the specific things that have to be documented for us to even use this code? Okay, this is where it gets really specific and you have to pay attention. To code a 76641, the report has to show an evaluation of all four quadrants of the breast, plus that area right behind the nipple, the retroareolar region, and if an axillary ultrasound, of the armpit area is also done, that gets bundled in as part of this complete exam. The key word here, you see it right there, is all. Every single one of these things has to be looked at and written down. Now, let's look at the other side of the coin, the limited exam, which is code 76642. And just like the name says, this code is for those situations that are a lot more focused and, well, don't meet all those strict rules for a complete one. Officially, 76642 is for a focused or limited breast ultrasound. I want you to think of this as your go-to code when the provider isn't doing a full scan of the whole breast, but instead they're looking at a specific problem or just one particular area they're concerned about. And here it is. This is the absolute critical difference. A limited exam looks at one or more of those elements we just talked about, maybe just one quadrant or only the retroareolar region, but, and this is key, not all of them. Even if the provider scans 3 out of the 4 quadrants, it is still a 76642. That little phrase, not all, that's the bright line that separates it from a complete exam. No crossing it.
All right, now for the part that brings it all home. I mean, knowing the definitions is one thing, but applying the rules correctly, that's what's going to make you a fantastic coder.
And this just lays it all out so perfectly. It shows you that core difference in one simple view. Look, on the left, 76641 needs all the elements. On the right, 76642 is for when one or more, but not all of those elements are checked out. It really is that clear. This should be the little checklist in your head every single time you read a breast ultrasound report.
Okay, listen up, because this is probably one of the most important rules in all of coding. It doesn't matter one bit what the doctor ordered. What matters is what was actually performed and documented in that final report. Your job as the coder is to code what was done, period, no exceptions.
And here's a huge restriction you have to know. These two codes, they can't be used together for the same breast in the same appointment. You can't start with a limited scan, then decide to expand it to a complete one and try to bill for both. Nope. You report one code, either 76641 or 76642, that accurately reflects the total exam that was performed. And finally, let's talk about the absolute foundation that holds up every single code you will ever assign, the documentation. Because without a good report, you can't justify a thing. Think of this as your final, non-negotiable 3-point checklist. To report any ultrasound service, you need 3 things. 1, a thorough evaluation that's written down. 2, images that are saved permanently. And 3, a final signed report that goes into the patient's medical record. If any one of these is missing, you can't report the service. It really is that simple. So what's the big takeaway here? You, as a coder, are basically a translator. You're taking a clinical procedure and translating it into a code that tells an accurate story. Your choice between 76641 and 76642 isn't just about picking a number. It's about writing the narrative of that patient's exam. So I'll leave you with this to think about as you move forward in your studies. When you insist on clear documentation to pick the right code, how are you protecting both the patient and the provider? You're saving the patient from being billed wrong, and you're making sure the provider's hard work is represented accurately. That's a huge responsibility, and you're now one massive step closer to mastering it.